Today we've got a very special guest here in Jupiter. It is Dr. Ken Gray, who is a doctor of Oriental medicine. He is also an expert in acupuncture and is on staff down at Jupiter Medical Center and also has his own private practice. He's also the host of the long-time running Maximum Health radio show, which I appeared on recently, which is how we connected, and it's a real pleasure to have you on the Paddison podcast. Welcome, Dr. Gray.
Thank you, Mr. Paddison. Good to see you again.
Yes.
You look so happy and healthy, and that's wonderful to know.
Thank you. Yes, certainly something that we both share is an interest in health, and it's funny to actually think that it's sort of a niche to be interested in health. You would think that everyone would be interested in it, but we all get so caught up in our careers and our other interests in life that we seem to get distracted. How did you become so?
I was going to say, I think it got to the point where we just had no other choice now. For a long time, we inherited genes of healthy people,
right.
Live off the land and have clean air, and now we have to choose our milk and our meats and our fruit. It's crazy. You can't just go buy anything.
Well, that's right. We have to be very careful. A lot of pitfalls these days. In fact, I would think that your average person following a typical Western American diet is going to end up having problems. I mean, have you seen throughout your career so far any shift just in that short period of time with regards to worsening health, or have you witnessed any trends that are alarming with regards to human health?
Yeah, definitely. I think one of the most interesting aspects of what I get to do is acupuncture for most people, or holistic medicine as I like to practice, which is encompassing and utilizing all of most of ancient therapies. So acupuncture being one, herbal heat therapy, herbs, homeopathy, which is not so ancient but still older than some of the more conventional pharmaceuticals per se. I think food therapy, all of these things under holistic medicine is not the first choice for most people here in the United States, and definitely not in Florida, which is considered, sort of a big pharma state. I mean, it's where people like that quick, fix. They like the pill, they like the surgery, they like anything that's going to keep them going. And unfortunately, that quickness, whether it's been in food through microwaves or, processed foods in cans and frozen foods, that's put us into the state of health that we are today, along with other choices that we could have probably, we could have chosen better, right? And so now my long story short is that I'm not the first choice. People like me are not the first choice for the majority. Mm-hmm. Still the majority.
Yep.
A doctor will refer to me when they have no other options. A patient or a family member may refer when they have no other options. So that group is growing.
Yep.
Yes. I'm having more and more people where they're searching me out for as soon as they get a sore throat, as soon as they get a tummy ache or a headache, I'm their first call. But it's changing now. We're seeing these changes and that growth in that area of medicine expand now. And I think it has a lot to do with people like yourself, spreading the word, making improvements to their own lives. And then when you make a change to your life that is obviously tremendous and for the positive, people are going to start to listen, because people want to know how people succeed, not how they fail.
Right. Exactly. Now, you work alongside other medical professionals who practice more of a what we would say like Western approach with medicine, a lot of pharmaceuticals, surgeries, and so on. Do you sometimes find that there is a conflict in approach between what you would like to see done and what is done? And if so, how do you balance that? And are you finding that it's becoming more synergistic?
Yeah, that's a good question. Balance is key. Balance of approach, balance of communication, balance of treatment. So for me, it's been one of kindness and compassion, being a teacher, being informative. You can't push things on anyone, and you shouldn't push things on anyone. And what's happening now with the explosion of information is that people can choose their paths from an educated standpoint. Mm-hmm. So when it comes to me, I do try to communicate with their physicians. I do try to meet with physicians of all kinds and when given the opportunity. And so that brings an added benefit to my patients so they don't feel like they have to choose. So I truly run an integrative practice, whereas if I feel that they need a different therapy than what I can offer, whether it's conventional Western or what have you, I will include that in their treatment plan and ask them to pursue it and do so by explaining to them why and how, what are the benefits, and what are their options. Now, I hope that there's a growth of that from the other end.
Yeah.
Find more MDs practicing, whether it's in the area of orthopedics or cardiology, neurology. I mean, neurologists.
Yeah.
On, right? They will start to educate themselves in application of someone like myself working in conjunction with their patients, not whether or not it dismisses their methods, but that it will increase the well-being of their patients. That's really what it comes down to is, are we going to put patients beyond ourselves and our limited scope to give them the best of what's available? And that's how I approach things.
I saw an example on YouTube just before we spoke here, as I was going through multiple bunch of videos that feature yourself. One where a woman had been through quite a significant surgical procedure, and you had administered acupuncture to that patient, both before and I believe after. And her experience was quite amazing. Can you give us an example of that I just described of how the acupuncture approach was so helpful for her in that not in a situation where she wasn't able to use the conventional pain relief?
Right. So that was interesting because she had a family member that was also on staff at Jupiter Medical. She was not the first time that this patient was not the first time that I was included in a surgical procedure pre-op, during, and post-op. And so what made this so special on top of anything was that this patient had horrible past results when it came to anesthesia and pain meds. So for her, it was a search to find integrative measures for this surgery, which was a double mastectomy with reconstruction. The doctor that was doing this, or doctors, because one doctor was going to do the mastectomy, and then another doctor, the plastic surgeon, comes in and does the reconstruction. The beauty of these two individuals was that they had admired me. I've treated either family members of theirs and several patients, either in this capacity or otherwise. So this particular patient was able to smoothly transition through my treatment to the day of surgery where I show up. I did the acupuncture right in the pre-op room, helped her naturally to de-stress, help to lower stress, not only for the anxiety levels, but because when you lower cortisol levels, the likelihood of having increased pain also diminishes quite a bit. The likelihood of having increased pain, right? You get less pain with less cortisol levels, so
right.
Less inflammation, better. So that being said, when I went into the operating room, I also did acupuncture. I taped down the needles, and you can find this on YouTube, my channel there at Earth School, look up Dr. Ken Gray, what have you. And it was a great piece by ABC News because what they showed was it was not in the way of the surgery. It was not anything that caused anyone stress, whether it was the nurses or the doctors.
Yeah.
And what that did was keep the body processing energy and blood flow and keep the stress levels down in the body during this traumatic experience, which people don't think of surgery as trauma, but it is trauma. It's controlled trauma. It's happening, whether you're aware or not.
Yeah, right. Yep.
And then post-op, I was able to help her in recovery and minimize pain. So the acupuncture for pain treatment was instrumental in the fact that she never had to use pain meds. So whatever minuscule amount was used during the surgery, once it wore off, she was purely at my disposal for the acupuncture, and I treated her at home. I went and visited her a few times a week, and she was up and moving, very quickly. Her recovery time was cut probably more than half, and that's a testimony that was shared by the doctors, which again is ABC News. Really, you can look it up on YouTube and search Dr. Ken, and I think we need to see more of that. because this woman is now still cancer-free. She's alive and well. She had a positive experience, and not everyone can say that.
Sure, absolutely.
Positive experience, able to eat and be nourished without nausea, without extreme pain and discomfort. Those are things we all should hope for if, and God forbid, we have to have these procedures performed.
What is it about the acupuncture, given that we are, as an audience on this podcast, pretty fresh to that concept? We haven't had a guest on to talk about this in the past, but what is it about that process that helped her with the pain reduction? And then can you extrapolate that and say how it can help people who have pain in their joints, which is our audience?
So pain reduction through acupuncture is the first application that found its way to America in the early 70s, once the doors of China were open to more trade and more, communication. And I think really the first thing that the scientists and doctors could agree on here was once you put this little needle into the body, it doesn't really matter if it's an acupuncture point, although it does help if it's an acupuncture point. There's a release of endorphins, feel-good hormones. Body realizes that there's a little injury to the body, there's an inflammatory response, and there's a release of feel-good hormones naturally from the body.
Sorry, because I've had acupuncture before, and I didn't feel good when it went straight in because you get that very, very slight amount of, something there. Are you meant to actually feel the endorphins, or is it at a level that's undetectable?
I would say the immediate feeling for most is not there because if you're for the first time having acupuncture, or your practitioner is obviously a little bit not too accommodating to the atmosphere. Of kind treatments, everyone's different. For me, I create a spa setting. It's very calm. It's very, nurturing. So healing starts from the moment you walk in the door. Now, that being said, the feeling comes once everything settles. Right. Yeah.
Gotcha.
After the needles are in, they start to feel pretty relaxed. And some will can sleep and some will be snoring by the time I come back into the room.
Wow. Is that right?
So that's the reality of that. So stress reduction, anxiety reduction, all of those things are fairly across the board accepted, and then within the community, the medical community. And secondly, they expanded into detox because, again, reducing stress, reducing cravings, whether it's drugs and alcohol, that's another thing that's medically, scientifically accepted. So pain reduction comes from this, relaxation, release of endorphins. Now, other than that, all pain and disease is related to the blockage of energy and blood flow. That's the number one rule that we learn when we start our education process. It's thousands of years old. Every Eastern culture believes that in some way, shape, or form, there's an energetic component to human beings that has to be affected in order to produce healing and reduce pain.
Okay, and so the acupuncture process of applying those needles into those particular places helps to free up energy and also assist in blood flow freedom as well, correct?
Correctly, because when you think of a cut, which is the simplest form of injury we can really wrap our minds around, obviously it expands after that, but that's a blockage of blood moving from point A to point B.
Right.
So the language of the body to tell you that system is compromised or that aspect of your system is compromised is pain. If we didn't have pain, we probably wouldn't pay attention to it.
Very
if
true.
it was feeling good, we'd probably do more of it. Right?
Sure.
Simple, but effective. So that's our language. We know through pain that we have to restore communication of nutrients, of nerve, which is electrical impulse, and furthermore, of energy or chi, which is life force.
Right. Okay.
When all of those components are communicating and traveling properly, we're in balance, yin and yang, chi is flowing, blood is flowing, and we're healthy and strong.
And so by applying the pin to that spot, there is a safe level of small amount of perceived injury by the body that sends energy to that area, a healing energy and nurturing energy that frees up blockage and gets that area functioning the way it should. Is that layman's terms of what's
That's a
going on.
good, simple way to start. That's the beginning. That's the beginning.
Cool.
You learn more of the system. You learn more protocols. You learn through extensive training and experience, which could take a lifetime. Combinations, of placement of these acupuncture points, organ, and there's there's a whole internal medicine component, which is dealing with the root of the system, deeper. The surface pain is really just a branch.
Yep.
So when you're looking at an area that's blocked, you also have to look at the root system and see if there's any damage or imbalance there. So over time, we develop those blockages and imbalances as well. And so each organ has a system-related component, liver inflammation. And that leads us to the talk of arthritis.
Yeah. Mm-hmm.
Rheumatoid arthritis for us is two main organs, lung and liver.
Mm-hmm. Fascinating. Well, please, you've got the platform. I'd love to hear more on this.
Lung and liver, liver is the general of the body. It's meant to keep the free flow of blood and energy moving. When we have a diagnosis, which is very, probably one of the most popular diagnoses in our society, in our country, is liver qi stagnation by the traditional Chinese medicine doctor. Why? Because we're the society of unanswered will. We most of the time want what we can't have.
Right.
So unanswered will produces stress.
Mm-hmm.
So this whole movement of meditation, mindful meditation, and being present is part of the healing process of bringing us more to a conscious present term and stress reduction.
Yep.
Right. Acupuncture is part of that and has been for many years, because the idea that we have liver qi stagnation, or the general of the body, which sits on the right here, that's why I'm pointing to it, is meant to keep if that organ is stagnated, then the whole system of the body is stagnated. And if we know anything about a machine, when you stagnate a process, it overheats. Overheating can be manifesting in all sorts of ways. But where it's going to manifest mostly is going to be in its joints, in the hubs, where energy can get caught and blocked.
Mm-hmm.
We know these hubs because the ones that overheat are going to be our joints. That's the main hubs of our body: hips, knees, elbows, fingers, toes, spine.
Yeah.
When they overheat, they swell, just as any machine would happen. You would have heat, blockage, pressure, swelling, inflammation. That's one aspect of rheumatoid arthritis.
Mm-hmm.
So we have to treat the liver to get that. And with a testament to you, there's ways of treating it beyond acupuncture that has to do with your daily process of what do you put in to feed the liver? Do you feed it inflammatory foods that's going to tax that aspect of your machine? Or are you going to feed it things that's going to enrich it and help that aspect of your machine work more efficiently with less stress, thereby rippling the effect of a balanced aspect of the machine to the rest of the machine of the body?
Yeah, just to work further into the metaphor, I think that, if we consider the liver to be overheated, and what do you do if you've got an overheated machine? Well, first of all, you slow it down a little bit, or you take some pressure off. If the flywheel's spinning at 50,000 revs per minute, then you slow it down a little bit. And we know that if you simply take your foot off the accelerator with the food consumption and you just stop eating for a day or two, virtually all the pain disappears in a rheumatoid arthritic body. And so that's the equivalent of just letting it cool. It certainly has the exact result that we're after. Of course, then we heat it back up again by eating all the incorrect foods. So tell us, you mentioned liver and you mentioned the lungs.
Right.
Yep.
So then the lung component, that's the root, and the branch of the lungs is the skin. So the lungs are the opening of the lungs is the skin. It controls the opening and closing of pores. Mm-hmm. Condition of the lungs. Now we see this relationship very clearly when you see a chronic smoker. If they have smoked for a long time and the lungs are dry, the skin's going to be dry. If the lungs are really filled with a lot of toxins, the skin is going to be not only dry but discolored, and so forth and so on. So the lungs and the skin are very much connected. Now, rheumatoid arthritis, rheuma for breath, gives us that connection to with the lung connection, and then arthritis for inflammation. Anything with IS we say is inflammation. So we know there's a lung liver connection because now it's not just the joints and deep, but it manifests to touching the skin, the surface. And you have even to the point where you have not only redness around the joint system, but even the skin to touch, the swelling of the actual skin, the dermis is affected.
Yeah, and quite often you'll see people with rheumatoid arthritis develop the psoriasis patches as well, and then you've got a diagnosis of psoriatic arthritis, which I just consider just to be two conditions or two manifestations of
same root.
Same thing.
And psoriasis is now heat, so that's red.
Yeah.
Have something called dampness or phlegm, which when things are not moving. But when a river is flowing free and clear, you don't have gook.
Mm-hmm.
You don't have gloppy areas. You
Mm-hmm.
have happy fish, life is flowing, grass is green, everything is nourished. Same with the body. When you have blockages, you have gloppy areas, things start to pool, you have areas of pain, and sometimes that pain can move. So you may not only stop at the joints, but then you have moving pain up the legs, in the arms, and then they'll diagnose you with something else called fibromyalgia.
Yeah.
But that's only because the root system is so compromised now it's expanding to other organs like the spleen, which is in charge of the muscle health. So that's the root system of the branch, the muscles, and digestion, and the gut.
Absolutely.
The spleen is the stove to the pot of soup, which is the stomach. So, and it's right across and very much connected physically to the liver. So usually after a while, you will get some involvement. And then, as you know, the gut being the center for inflammation, as conventional medicine is now accepting, that's kind of a broad stroke. And then they say just take probiotics. But it's more comprehensive. Like, it's not just taking things, it's also eliminating certain things. It's also bringing a balance to your life and what you expose yourself to. And like I always say to my patients, food is not only what you put in your mouth, it's everything that you feed your body. What you look at, what you listen to.
Right. Yeah, it's a good insight. Yeah, absolutely. And basically, every thought you have is in some way some kind of food for your body, isn't it? Right. Yeah. Everything you see, I like that. Yeah, it's so true. We're just sponges for our environment, aren't we? And the consumption of food is just an extreme version of that consumption. But the subtle ones, picking up on negative energy from other people and so forth, I think that's a great insight.
Saying without a balanced mind, you kind of have a balanced, digestion.
Yeah.
If your mind's all over the place and you're shoving food, you're going to have indigestion. And so we have a society that lives off of all sorts of reflux medications and things, destroying our guts, just because we want to keep stress eating foods that are not helpful. And we want to mask the acid that's being, an indicator for us that we need to change, our consumption, not only of what we're putting in, but what we're allowing to stress our lives and to destroy our joy and our peace, make better choices, because without quality living, it's really not much of a life at all.
Exactly. So what's your favorite patient? If someone walks in and says, Dr. Gray, I'm here because of XYZ, what do you just sort of do this with it, and you say, this is going to be fun because you know that you're going to be able to turn them around?
That's easy. A patient that comes in with gratitude already in their heart. They may be suffering, but they're still grateful for every day. When someone's grateful, you can work with that. The complaining patients are probably going to complain no matter what happens. And the patients that are in honest pain and just don't know better, that's fine. I'll take them. That's not, they can be changed. But I feel like the patients that are complainers in life, that feel like everything is a tragedy, the weather, whether or not they did well at golf or tennis or, their cars in the shop, everything's a tragedy. They're always going to be unhappy and they're always going to be unhealthy. But the patients with gratitude, and I shouldn't say always, I think that was a poor, I don't want to take away hope for people like that, because I was once a person like that. but it takes a lot to change. And I have a life of healing, which is mutual. So because I'm hands-on, it's not just going out, it's also coming back, right?
Mm-hmm.
So, but I can say that my favorite patient, which is the answer, is the one that presents with the spirit of gratitude. They're just grateful for everything. And you just know that their healing is going to be a much quicker process and a much more joyful and comprehensive process, much more enjoyable.
Yeah, as you said, from both sides, being also in a position where I work with people in our support platform, also on a coaching basis. You know that when people show up and they've just got this sort of glint in their eye, like this is going to work and this is exciting. Yeah, I can totally relate to that. And
it's not always immediate. It's not like they're just going to come in and all stuff that they're seeing.
Yeah.
I mean, that's not the impression I'm trying to get. But once you sit down with them and given time and you help them understand that you are connecting with them as a person, and they take that and they say, no matter what, I've got someone in front of me that cares.
Yep.
And they have this sense of thank you.
Mm-hmm. Yep.
You can be thank you for your time. Thank you for your trust. Let's go forward together and do our best together. Mm-hmm. And they're going to listen to you. They're going to go out and get the right foods and the right supplements. They're going to, they're not going to say, it's your work. You fix me. That's rarely the situation of gratitude or a person with gratitude.
Yeah. Well, let's think of it the opposite then. If we look at the other extreme, what do you think is the most counterproductive emotional trait to have in terms of being able to heal?
Oh, I think being self-absorbed.
Right.
I think if you become your pain or your disease and you call it yours or mine and you possess it, already creating a bad situation. So I try to inform patients when they say my this, my that. I'm like, it's not yours. It's just a series of imbalances over time that we need to rectify over time.
Mm.
So I try to get them out of that place of claiming their disease and starting to speak more positively, because words and thoughts become things, really. So it's essential to change one's their consciousness in order to accept the healing, because you can fix them. I've seen patients that they have frozen shoulder and then, you get the motion back, but they still insist that something's still wrong because they're not accepting the healing.
Mm-hmm.
They have become their healing. They become whatever they happened over time. And they were in that space for so long with their family, their friends, their coworkers, that they don't know how to bring themselves out of that disease. And they've identified themselves as part of that disease. Yeah. So let's say becoming self-absorbed is all of ours. We all have to work at that constantly, because we can become whatever is, is keeping us down. But once we say, okay, what can I do today outside of myself to help, to improve, to so forth and so on, I think we open up doors that will allow for healing on many levels, not just physically, So just keep moving. We spoke about exercise, for instance.
We did.
We don't like to do things that make us uncomfortable sometimes, but sometimes the things that make us uncomfortable or may not bring us immediate joy, but may bring other people joy. Or, these are all things outside of ourselves.
Yeah.
Are not always easy, but I feel that those are the things sometimes we need to do to, push forward.
Mm-hmm. Yeah, I love that. Just going back a second before we talk about exercise, the self-absorbed, I think, is a really good thing that we all need to be mindful of, and the ownership of the disease is something that I never did myself when it came to my condition of rheumatoid arthritis. I always spoke of it as something that I was working on, of a problem that I was trying to fix. It never had any kind of personification. it was just a thing that I wanted to get rid of, and it wasn't part of me. And I could never identify my life and it. It was a separate part of me that I just wanted to extract. I just wanted it out. That's how I thought about it. And I think that that's a great reminder about the words. This isn't, my disease, my this. No, it's the way you described it. And it's something that I often say it's a project I'm working on. It's not even something that we should be trying to be too emotional about. It's just, it's something that we're logically and non-emotionally, systematically working towards eradicating. That's how I like to think about this. I got a physics background.
It was a challenge that, you met and improved your life. You never saw it as, this is my life. It was just a challenge. That showed up to make you better. And you saw your way over it, But yeah, I think if the opposite would have been, oh, woe is me. Why did this happen to me?
Oh, and they exist.
What did I do for this to happen to me? And your girlfriend, who's now your wife, would have left.
That's it.
You never would have the audience that you have.
Mm-hmm.
And life bloomed into this gorgeous, beautiful flower because inside of you stayed this beautiful And so, we have to stay diligent no matter what comes. Oh, that's not a wall. That's a step. I just need to step higher.
Mm-hmm.
We all have them. We all have the challenges. It's part of the journey, which makes us so special. But healing comes, the opportunity for healing comes in so many ways. For you as, rheumatoid arthritis. And for a lot of patients watching this, obviously it was rheumatoid arthritis.
Yeah, right.
Or is. And so every day a little bit of chipping away can happen, at yourself, at the ownership of that, of what it is, I know people that may have some indications of it and they just get thrown this diagnosis. And sometimes you go to them, well, just because you have some of the, you don't really have that, or you don't want it, you don't have to claim it.
Yeah, right.
You just have a little joint pain and maybe your levels in your blood and so forth and so on, but you don't have to act like that person.
Right.
Stay with it and shut down the rest of your life.
Exactly. That's right. No, I totally can relate to witnessing that. So as we come towards a close, let's talk briefly about exercise. But then, if there's also a personal story that you'd like to share that would be nice too, I'll think of the right question while we just take a small piece of time to talk about exercise, because my audience all exercise. Everyone's knows the importance of that. But do you have a lot of success getting in ways of encouraging people to exercise is a good question, because how can you help to encourage your patients to exercise? What techniques have you found that have been good at getting results?
I mean, first of all, a lot of times when you have these chronic diseases come across your desk, table, what have you, for me, you have to develop a relationship before you start suggesting anything,
right?
Besides the immediate treatment that they're looking for. So I think as time goes on, you just start talking about it depending on the person and their mindset. You really have to be connected and conscious of what they're willing to accept and what they're willing to hear. And then it's just a matter of conversation, like I said, and suggestions. What do you love to do? What brings you happiness? Maybe we can try yoga. Have you tried yoga? No, I can't. I can't sit still. Well, now you can. Right. Try to have a sense of humor. Try 20 minutes. Tell the teacher, look, I don't, I don't care for yoga too much, but I want to try it, and I think I'll try 20 minutes, and then if it's okay with you, I'd like to leave. And if they're not interested in your parameters, then you find another studio.
Sure.
Don't just say I tried yoga and I hated it because of the person. Just there's so many studios for a reason.
Yeah.
Same with different forms of exercise. As long as you keep moving is the key. And so we'll go through swimming. Do you like swimming? Oh yeah, I like swimming. Yeah. You like gyrotonics, which works on the core. At least you'll be working your core. If you don't want to work your legs because your knees hurt, maybe do some gyrotonics, which just works the core. And so really it's just about myself trying, I am experienced because I, as a physician, have to heal myself constantly.
Mm-hmm.
Right. So I think that's the other aspect too, is once you've had challenges, once you've come through your own challenges and journeys, you have more substance to offer your patients. So for me, these conversations are real because I've been in, incapacity to a car accident, laid up in a hospital. I've had dislocated that and broke, like not
Right.
broken, thank God, but I've had a lot of injuries,
Right.
I think I drank a lot of milk as a kid. I've been banged around, and they were like, "I don't know how you're not broken." But no, but I've had injuries. I've had a lot of things go on, and so with each challenge that I came through, I can now share those experiences, and it's like a patient's interested in you if you're more human talking to them.
Yeah.
If you know what I mean?
Yeah, yeah. Yeah, we've
I
all
think,
had the experience with a general practitioner where you walk in and sometimes you're a few minutes into the conversation before they've looked up from their computer. I mean, I have had experiences like that. Yeah.
you don't want that. That's not
No.
going to help
Yeah.
you.
Yeah.
My patients ask me, "Well, doc, I really want a glass of wine, and I know to talk about wines that have less sulfates, or
Yeah. Yeah.
sulfites, or
Yeah.
old world versus new world, or
Yeah.
potato vodka versus And so I don't advocate alcohol, but the point is a patient sometimes doesn't want to hear, "No, drinking's bad.
Yeah.
No, bread's bad. No,
Yeah.
this is bad. That's bad." And it's like, well, what do you want me to do? It's like
Yeah.
Johnny Carson once said, "Okay, if I give up sex, alcohol, and drugs, then I'll, what's next? Suicide, right?"
Right. Right.
But we all
Yeah.
have our things that equals life, right?
Yeah.
Like this is living,
Yeah.
and whether it's fishing and a little wine or this and that and the other thing, there has to be something to, like a carrot, to
Yeah.
dangle to keep you going.
Yeah.
And so I think, in the healing process, as you know, we can always have stringent disciplinary times. Sometimes you've got to fast, you've got to whatever, but you also have to have the times where you can have a joke and a laugh and talk about some things and, fun foods, fun activities and such. And so once you connect on all those levels, they're more likely to listen to you when you say, Mr. So-and-so, Mrs. So-and-so, I really need you to get into the yoga studio today.
Yeah.
Time.
Yeah.
Because you've already laughed at them.
Yeah.
Yeah. They know
Yeah.
you're there with them.
Yeah. 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 That's right.
I'm not chastising them. I'm not here to belittle them. I'm here to see them achieve the best life that they were meant to live.
Yeah.
That to me is true healing.
Yeah. Yeah. Beautiful. And so just to wrap up then, what does the future look like for Dr. Ken Gray? How are you going to grow personally and also with your practice over the coming years?
I think growth for me is not so much this idea of expanding necessarily past what I'm doing as much as just more of how many I can reach. So for that, obviously I can only hands-on heal so many people in a day. And, I remember, thinking, oh, if I could only heal 8 people a day, I'd be doing good. And then it was 10 people. And then it was like 21 people. It's like, and it's not the type of healing where it's here, take this pill or, just a surgery. It's hands-on conversations, food therapy, acupuncture, aromatherapy, which is Chinese medical massage, the use of biopuncture, which is, using homeopathics injected into acupuncture points, which I learned in Germany. And I'm ever learning, I'm ever expanding in that way. So that's the growth aspect. But then I was asked years ago to do the radio show. So I've got Maximum Health, and that's on NPR, and that's about quality living. And so I'd like to see that go national. I'd like to see it, because it's available on podcasts worldwide through the Public Radio Exchange, prx.org. But I'd like to see NPR pick it up, and then it's in all markets, just as any of their bigger shows. And I'd like to do more television. My YouTube channel I'm working on now to expand live streams like we did, and more recordings. So I'd like to do that, and I'd like to be able to reach people in a visual aspect that's positive, and sort of do this sort of natural reaching and healing of millions a day without losing myself or my family. I'm still maintaining a quality of life for myself. So however that manifests, I'm leaving up, I don't have these, immediate pictures. I just have like I told you, the wows, not the hows,
Yeah.
And the wows for me will be healing many, being a healing force in this world to millions every day, whether it's just sharing or, allowing, others who are doing great works to have a platform, creators and creation, that sort of thing. But, for me, I'm really happy. I can tell you that honestly. I feel effective every day. And if I can maintain that, then we're doing good.
I love that. I love that. Feeling effective every day. That's a great way for us to close up, and really appreciate your time. And I'm sure all those things that you just talked about are going to happen. And, it seems like when you've got a plan that's going to serve a lot of people, the universe tends to step up and help it to happen, doesn't it? So I'd like to also thank you again for having me on your Maximum Health Radio that you just mentioned a few weeks ago. And to anyone who hasn't come across it yet, certainly just jump on Google. You'll be able to find that radio show and tune in each week to Dr. Ken Gray. Thank you so much for coming on this episode.
And please subscribe to the YouTube. I'd appreciate it. The YouTube, .Ken, DOC space Ken. And a lot of good information.
Awesome. And how can people reach out for you? If they're local to the area of Jupiter or Palm Beach, can they come and see you via your website?
Yeah, drkengray.com. That's GREY. So easy website, has phone number and such. Email drken at drkengray.com.
Awesome.
Yeah.
All right. Well, thank you so much.
Thank you.
Okay.
See you.